Assalamu alaikum warahmatullah. This is the second part of cell injury. We'll talk about necrosis and apoptosis. Okay, what is the necrosis? Necrosis is the death of cells or groups of cells which are still part of the living tissue. It may be rapid or gradual. It is the end result of irreversible exogenous cell injury. We talk about the cell injury if there is a short term or acute injury, the cells can revert to the normal cells. But if the cause of the injury continuous or progressive, that will lead to what is called necrosis. Okay, causes of necrosis are more or less the same for cell injury. Necrosis due to hypoxia is called infarction. These cells, this picture explain the normal cells if exposed to the that lead to these changes in the cell, swelling of the endoplasmic reticulum and mitochondria. There is myelin figures. Okay, from this stage can over to the normal cell. But if the cause of energy continuous and become progressive, this can lead to necrosis, which lead to breakdown of the plasma membrane and nuclear and leakage of the content of the cells, and this lead to the necrosis if these if this cause of the injury continue. Okay, sorry. This is what is called gangrene. Okay, observe this black color. This type of necrosis associated with infection, okay, lead to the amputation and usually occur in the patient had small artery disease or diabetic artery disease due to diabetes observed or to amputation of these of these fingers. Morphology of necrosis. The athletic enzymes come out and lysis take place, which can be autolysis, one enzyme from the dead cell itself, or heterolysis from lysosomes of invading inflammatory cells. After few hours, microscopic changes take place. If we see these tissues under microscope, there is cytoplasmic changes. Cytoplasmic eosinophilia. Eosinophilia, we said, means pink staining. Under microscope, we will see the pink color from the eosine dye and the E in the hematoxylin and eosine stain. Vacuolation inside the cytoplasm. Also, there is nuclear changes. She take one of the form karyolysis when the basophilia of the chromatin fades. Basophilia mean purple color. There is karyolysis, that means or pycnosis, nuclear shrinkage and increased basophilia, or karyorexis when there is fragmentation of the nucleus. In general, the cells may have a more glassy homogeneous appearance. Glassy one color, usually it would be all. There is disappearance of cytoplasmic edges and the nucleus. There is just a color. Types of necrosis. Coagulative necrosis. Coagulative necrosis. Sorry. معلش يا شباب أنا الليل شوية. Types of necrosis. There is coagulative necrosis. when we said coagulative necrosis, when the necrosis occur in the solid organs, after this cell outlines are after this of the cells outlines are preserved, called ghost cells. Ghost cells يعني like شبح. This occur in solid tissues like heart or liver, for example, with preservation of tissue architecture. The tissue architecture preserved, but the outline of cell, the outlines of the tissue is preserved. Okay. Presumably, the injury denatures not only structural proteins but also enzymes, thereby blocking the proteolysis of the dead cells. The dead cells will be in its site. The cellular debris is then removed by phagocytosis. Coagulative necrosis is characteristic of, in fact, in solid organs. We said like heart, like liver, and so on. This coagulative necrosis, observe the right side, just homogeneous color of the pink color. But in the left, observe there is nucleus and there is cytoplasms. Okay, this example of coagulative necrosis in the liver. This also necrosis observes nice cells, very clear in the right of the picture, but in the left of the image there is homogeneous colors of pink colors. Okay, this necrosis. Okay, observe the ghost cells, like just like a homogeneous color. These two rounds color pink color, these ghost cells. Okay, under microscope. Liquefactive necrosis or colliquative necrosis is complete loss of the tissue architecture occur. There is liquefaction of tissue. liquefaction يعني بتبقى liquid سائل. Okay, this occur in tissues with high water content like the brain, usually occur in the brain. Also is seen in focal bacteria or occasionally fungal infection because microbes stimulate the accumulation of inflammatory cells and the enzymes of leukocyte digest, تعمل liquefaction, liquefy the tissue. In this state there is abscess formation will occur. Okay, abscess formation اللي هي بالعربي بنقول لها خراج. اوكي اللي هو عندي focal bacteria فبتعمل لي stimulate accumulation of inflammatory cells, بتعمل لي digestions of these tissues and liquefaction. Okay, and called abscess formation. Also we have caseous necrosis. Tissue lose its architecture and become amorphous, granular and eosinophilic. Again, the tissue looks like cheese عشان كده بنسميها caseous. Okay. The gross appearance of the tissue will be like the cheese. For that called caseous necrosis. It is associated usually with tuberculosis infection. Unlike with coagulative necrosis, the tissue architecture is completely lost and cellular outlines disappear in these necrosis. The area caseous necrosis is often enclosed within distinctive inflammatory borders is called granuloma. Caseous necrosis usually the body defends itself with granuloma formation. There is distinctive border around these cases necrosis and called granuloma in the tuberculosis. Also there is what is called gangrenous necrosis. It is combination of necrosis with secondary bacterial infection is called gangrene. When the coagulative necrosis predominates in the gangrene, بنسميها dry gangrene, but when there is liquefaction predominate called wet gangrene. A variety of anaerobic bacteria may be involved like Clostridia groups in these gangrene. Observe this gangrenous necrosis. There is usually this black color. Okay, and there is some dark color in others pictures, not black. Observe these gangrenes in the toes of the foot, and in dry gangrene in the fingers of the hand. There is also fat necrosis from the name occur in the fatty tissues, found in fatty tissues, occur in acute pancreatitis where lipases separated act on fat cells, and in the presence of calcium salts, fatties may form like soap. There is calcium salts and fats. We call these like a soap. Also occur in breast due to trauma because the breast is full of fatty tissues. Also, there is fibrinoid necrosis, which occur in tissues where the fibrin, there is a lot of fibrin, which in the arteries occur in blood vessels due to high amount of fibrin in the blood vessels. Sorry, not just arteries, to high amount of fibrin. Usually, in immune reaction like on autoimmune diseases, in which complexes of antigen and antibodies are deposited in the walls of the arteries. The deposited immune complexes, together with fibrin that has leaked out of the vessels, produce a bright pink and amorphous appearance on H&E preparation. H&E قلنا دي الستين بنعمل بها الستين بتاعت التشو نشوفها under microscope, called fibrinoid or fibrin like. Observe these pink colors around on the artery. This is a fibrinoid necrosis. In artery, the wall of the artery show circumferential bright pink area of necrosis with protein deposition. This circular pink color, this is a fibrinoid necrosis in the artery. Okay. Now we talk about other things called apoptosis. Apoptosis is called programmed cell death. What is the meaning of that? Apoptosis results from activation of enzymes called caspases from inside the cells itself, may occur physiologically or pathologically. Physiologically occur when cell lifespan come to end، يعني خلاص السيل دي أكملت مهمتها عايزة تموت ويحصل لها أبوتوزيس. أبوتوزيس اللي هي programmed cell death، ما زي النيكروزيس جاتنا infection or cell injury أو كده. This programmed cell death. Okay. Apoptosis is a pathway of cell death in which cells activate degrade the cell's own nuclear DNA and nuclear and cytoplasmic proteins. هي السيلز ذاتها بتكسر نفسها. اوكي، فاسمها program cell death، يعني حاجة منظمة، ما زي النكروزيس جانا حصل injury وحصل لي necrosis و tissue affected and so on. Apoptosis not affect the other tissues. Okay, it is a programmed cell death. The dead cells breaks into fragments. Apoptosis falling off. Some cells may be shed from free surfaces, and some are phagocytosed by the adjacent cells or macrophage to form apoptotic bodies. Observe this picture. The normal cells بيحصل لي cell shrinkage and chromatin condensation. In the necrosis there is cell swelling صح؟ هنا عندنا cell shrinkage and chromatin condensation. There is membrane bleeding, nuclear collapse, then fragmented to small bodies called apoptotic body formation. Then the lysis of these apoptotic bodies are phagocytosed by the macrophage or other cells. Also, this picture. Apoptosis can be physiologically or pathologically. For physiological apoptosis, death and shedding of cells of the endometrium during menstruation, this type of apoptosis. Formation of digits in embryo, this type of physiological apoptosis. End of lifespan and elimination of cells that have served their useful purpose, such as neutrophils in acute inflammatory response. Okay, all these examples for physiological apoptosis. Pathological apoptosis in tissues undergoing pathologic atrophy. Okay, occur in tissues undergoing pathologic atrophy. Death of abnormal cells in cancer, for example, induced by cytotoxic T lymphocytes. This table compares necrosis and apoptosis. Necrosis is always pathological. Apoptosis may be physiological or pathological. Necrosis affects adjacent groups of cells. Apoptosis affects just single cells. Cell size increase in necrosis. Here, cell shrunken in apoptosis. Necrosis passive. There is no need for energy in necrosis, but active in apoptosis, we need energy for apoptosis. Necrosis causes inflammatory reaction, non-inflammatory reaction in apoptosis. Plasma membrane is disrupted in necrosis, but plasma membrane is intact in apoptosis. Morphology of apoptosis under microscope in H&E stain tissue section. The nuclei of apoptotic cells show various stages of chromatin condensation and aggregation, and ultimately karyorrhexis. Fragmentation of DNA. The cells rapidly shrink and fragment into apoptotic bodies. Observe these cells. These fragmentations of these nucleus. This is called karyorrhexis. Okay. These also picture or diagram explain the apoptosis. These cells under microscope. Observe these cells in front of the arrow. There is no distinct cytoplasm or distinct nucleus, not like other cells in this picture. Okay. Apoptosis characterized by involve single cells, where necrosis is going to involve group of cells. Energy dependent, active process in the apoptosis, while necrosis no energy passive. No inflammatory response in apoptosis and present in necrosis. Chromatin is broken down in a regular fashion by endonucleases in the apoptosis. Okay. This diagram compare between again between the necrosis and apoptosis. Okay, and that is all. Thank you so much.